Parents and parents-to-be, let's talk about the first controversial decision you will need to make when your new baby is born, whether or not to receive the vitamin K shot. Hi, my name is Dr. Trevor Washburn. I'm a board-certified pediatrician and father of 4. I'm here talking about common concerns and controversies surrounding pediatric care, things that I talk about with my patients day in and day out. So, what is the big deal about vitamin K? Vitamin K is a necessary vitamin for your blood to clot. Newborns already come delivered in a vitamin K deficient state. They're not getting significant quantities of it through the placenta, through the breast milk, and it's not quite being made in their gut yet until about 6 months of life. So they're at higher risk to have vitamin K deficiency bleeding. We care about it because it can happen for babies that do not receive the vitamin K shot. Up to 1 in 200 babies can have early or classic bleeding. So, bleeding from the umbilical cord, bleeding from some type of bruising, bleeding from some type of open wound, or something of that sort. But what we care about the most is the late vitamin K bleeding, which can happen even up until 6 months of life. And that bleeding, the reason why it's scary is it will typically happen spontaneously, meaning you didn't cause anything to happen, it's just going to happen in the brain, or sometimes internally in the gut, sometimes under the skin. But you're not going to know about it until it is too late, until the damage has already been done. I have seen a case of this in residency where a baby ended up having internal brain bleed because they did not receive the vitamin K shot and ended up with cerebral palsy. And it's terrible, especially knowing that it was 100% preventable. Let's talk a little bit about the history of the vitamin K shot. I think sometimes parents feel that this is something new, or they are that it's changed in recent years. And I think definitely in the post-COVID um, state, that people thinking with a little bit of that distrust for medicine, kind of anti-government, anti-medicine establishment trustworthiness, people are worried about the vitamin K shot. The vitamin K shot has been something that researchers have known about and used since the 1940s. And it has been approved by the American Academy of Pediatrics and recommended for every patient since 1961. So that is over 60 plus years of giving this vitamin K shot to literally millions of babies around the globe. With that, it has been shown to be very safe and effective, and something that you can trust. So let's talk about some common controversies that exist around the vitamin K shot, especially among parents and on the internet. First, a lot of parents are concerned that the vitamin K shot has some type of preservatives in it that are going to be toxic or harmful to the baby. We know that this shot has been given for 60 plus years, and there has been no scientific evidence or substantiated claims that this is causing any type of neurologic or poor health outcomes. There is, in fact, a brand, at least one, of preservative-free vitamin K shot that really all it has is the vitamin K and emulsifier and a salt to help balance the acid-base status. If you feel uncomfortable about the vitamin K shot, and maybe I can link it below, we can put the list of the ingredients there that you can look up. Any hospital can provide you with the ingredients for the shot that they are giving, and you can look at the package insert. Second, some families feel, well, my baby looks very healthy, we had a smooth delivery, this vitamin K shot isn't necessary. You know, most babies are healthy, just like most people are healthy and do fine. But if you have enough babies that are not getting the vitamin K shot, some of them are going to start having bleeding. And I have actually seen a case of this in residency, which was terrible. A baby who had internal brain bleeding and ended up with cerebral palsy. I think knowing that this is 100% preventable is what makes it that much more terrible. Another common controversy or question that I hear about the vitamin K shot is that there is a boxed warning, sometimes called a black box warning, about anaphylaxis for the vitamin K shot. This is placed on the medication because vitamin K is also given to adults, sometimes through an IV. For instance, if they're suffering from a Coumadin overdose, if they're bleeding out as an adult, we can give vitamin K to help with that and counteract warfarin or Coumadin's effects. And there have been cases in adults where they've had reactions to this. To my knowledge, there have been no noted cases of newborn anaphylaxis to the vitamin K shot that is given routinely after birth, besides perhaps one case in India, and that's in the last 60 years. So I don't feel like this is a real significant threat or harm that parents should be worrying about. Another common concern or question that I hear a lot parents will raise is, why do I need to give any of these medicines to my baby, such as vitamin K? God made my baby perfect and whole, and I don't think I need to inject something into their body. I don't want to get too theological here, but I believe in God, and I believe that your baby is a wonderful, beautiful creation. However, we all know that nobody's life here is perfect, no one's health is perfect, and all kinds of things can happen. So I wouldn't, not buckle myself in or wear a helmet when I'm biking or take some of these basic safety precautions thinking I'm whole and I don't need to have any of these type of safety interventions. This is a very safe basic intervention that can be provided to your child to help protect them. Another concern that I often hear is the vitamin K shot is like a vaccine. It's not a vaccine. It's not inciting the immune system. It is a vitamin. It's not preventing some type of illness. So it really is different. The only thing that makes it similar to a vaccine is just that it's given via an intramuscular shot, just like you could give a steroid, an antibiotic, and lots of other medications via a shot. I would say one of the primary concerns parents have is just not wanting to poke their baby. I get it. I don't want to poke your baby. Surprised. Even though I'm a pediatrician, I don't get joy out of that. I don't want to poke my children. But part of being a parent and just a person is doing things that are uncomfortable but keep us safe and healthy. I want my kids to be safe, healthy, protected. I want your kids to be safe, healthy, and protected. Let's do the small poke. Let's reassure them afterward. Let's breastfeed. Let's comfort. Let's swaddle them. Let's do all the things. The babies get over it so fast. I see these shots given, hundreds to thousands of times. I've never seen a baby that's had a significant issue with it. Another concern that I hear about the vitamin K shot is that it's going to damage their liver or it's going to cause them to have increased jaundice or something like that. Now, it is true in the old days with the higher dose of vitamin K when it was given, and I'm talking decades and decades ago, in 40s, 50s, 60s, there was increased jaundice with the vitamin K shot. There have been some studies that have said maybe the jaundice level is a touch higher with vitamin K. At the current dose of 1 milligram given intramuscularly for vitamin K, there is no significantly increased risk for your baby needing phototherapy or having some type of harmful effect from jaundice. Your baby's liver can definitely handle 1 milligram of vitamin K. Another common question I get about vitamin K is, can I still give my son a circumcision? Can he still be circumcised if he has not had the vitamin K shot? No. At least for me. I'm sure you'll find someone out there who is willing to do it and take that risk, but I think it's foolhardy and it's not safe. Why? The primary complication of a circumcision is bleeding. That's the number one possible complication you're going to have. So then adding on top of that, not having the medication that is going to help you with clotting your blood, I think is it's risky. It's kind of like if you asked me to drive your child home but said my child will not wear a seatbelt, I'm going to tell you, too bad, I'm not driving them. We would probably make it to our destination fine, and probably no one would get hurt, but that's not a risk that I'm going to take when there's a very simple intervention to be safe. Let's talk about oral vitamin K versus the shot. While on an individual basis, I think there is some good evidence and reason to say that giving oral vitamin K is definitely helpful and could be a future alternative to the intramuscular shot, at least for now in the United States. The only FDA approved medication and dosing and regimen is the intramuscular vitamin K shot. The reason that's the case is because it has lower breakthrough rates of bleeding. It is essentially zero. For every baby that actually receives an intramuscular vitamin K shot, you are not going to have bleeding. There is some potential for breakthrough with oral vitamin K, especially if you're not given the appropriate dose or appropriate frequency of dosing. There's no prescription that a doctor can write. A pediatrician, family doctor cannot write you a prescription for oral vitamin K, and it is not regulated. So you need to go out and buy one online. But you don't know if there's even vitamin K in it because no one's checking that. You don't know if the dosing's correct. And just from a public health standpoint, asking parents to give a regular vitamin K shot to prevent something as severe as potential brain damage from bleeding internally in the brain is risky because a lot of families just struggle to give the daily vitamin D shot. I think for me personally, when I see families who are in crisis, struggling, having difficulties at home, chaotic home life, trying to rely on them to remember to give this oral vitamin K, some people are not going to do it. And that's why the shot is kind of more foolproof. But with that said, there is definitely some good evidence around giving oral vitamin K or babies who are fed formula that has vitamin K in it, or following some of these other dosing regimens, but it is not something that I would recommend. In summary, I 100% recommend you giving your baby the vitamin K shot. It is safe. It is effective. It has shown to be so for over 60 years. There is no substantiated evidence to show otherwise that this is risky or harmful or dangerous. I've given it to all of my children. I recommend giving it to my patients. I have not seen a single patient in the hundreds of patients that I've seen get it that have had any significant bad outcome, really any outcome that was negative at all. The body of evidence there is huge. I would just hate for one of my patients to get brain damage for something that was 100% preventable. And I do not want that to happen to you. I do not want that to be your family. Let me know if you have any questions and drop any questions or comments below.